What started as a little kernel has continued and grown and been there for the people who need them.
I grew up in Bridgeport, born in Bridgeport, Park City Hospital, graduated in 1976 and went right off to college. And I was a life skills counselor. So I would go out to Thomas Merton Center to look for clients. Once I experienced Thomas Merton Center, I wanted to work there. An opportunity came for me to take a position, and so I jumped at it.
I had a 30-year Wall Street career. There was always something a bit missing. I had a couple of friends who were on the Catholic Charities board, and blessed and honored that they asked me to consider the Catholic Charities job.
There's been different directors, staff that stay there for long periods of time.
And went on to get my clinical license in mental health and substance abuse addiction. And I was gone for about 25 years. I remember giving Christina a call. Sure enough, there was a position open.
Bill's done a tremendous job being with our guests.
About 3 years ago, I became the director of Thomas Merton Center.
When I came into Catholic Charities, it was January of 2020. Catholic Charities has 35 different programs doing fantastic work. But a lot of those programs ended up being relatively siloed. So if you had a housing issue, you spoke to one group. You had an immigration problem, you had to go somewhere else.
Back in the 90s, the population that we were getting was kind of an older population of people. These days, we're seeing a much younger population, more families. People find themselves, out on the street at 18 and 19 years old.
We realized it would be much more effective if we could provide a lot of the services in one facility. And so that's when we embarked on this family center concept.
One of the most impactful pieces of this new building is going to be healthcare. We're going to have healthcare with Southwest. They can go right upstairs to their medical. They don't have to go across town. They don't have to worry about transportation.
Partnering with somebody like Southwest is really fantastic for us. And we don't need to replicate something that someone else is already doing really well.
The word immigration didn't really come up much, but nowadays, it's one of the main points that we're dealing with throughout the country.
Then also career resources. We really wanted to have job training resources available to our guests in this facility. Recovery network of programs, their specialty has been substance abuse training.
A housing component that's going to help people be able to navigate that process. I'm really excited about the partnership with Housatonic Community College. People have an opportunity that would help them to a better quality of life.
This facility is going to allow us to work together closely with partners and everybody bring their expertise to bear. And we think in those cases, 1 + 1 can equal 3 or 5 or 7.
Hard to imagine that it would come to this little group of people who were in a little prayer group and went out chasing after people to give them sandwiches.
We are able to come into beautiful new space. It's all the services that will make a difference.
This never, ever would have happened without the work of so many caring, compassionate donors who have allowed us to make this dream become a reality. We're going to be able to help a large percentage of our guests get on that path to self-sufficiency.